Medicare is one of the harder decisions to change in retirement when it matters. It catches a lot of retirees off guard. Yet when I talk to people about it, I tend to hear the same thing over and over again. I'm going to try one option and I'll switch it later if I need to. On paper, that's true. There are switching rules that exist. But in reality, it's often much harder than what you've probably been told. Hi, I'm Nick Morrison, a CFP professional based in Raleigh, North Carolina. I work with people nearing or in retirement. I come across a lot of confusion when it comes to Medicare. Not because people aren't smart, but because of the way the options are presented. It leaves key nuance out. Let's fix that. Let's start with the basics. You generally become eligible for Medicare when you turn 65, but it still leaves you with some significant gaps in coverage. Part A covers hospital visits. Part B covers doctor visits and outpatient care. Together they cover a lot, but here's the problem. Original Medicare covers 80% of your costs, the remaining 20% is on you. And there's no annual maximum. If you have a serious illness, a major surgery, a prolonged hospital stay, that 20% can add up fast with no cap on your exposure. It's also worth noting that Original Medicare doesn't cover prescription costs. It doesn't cover vision, dental, or hearing services. And it doesn't cover long-term nursing or home health care. That's the gap, and that's the problem that both options we're going to talk about today are designed to solve for, just in very different ways. If you want to cover the gap when you enroll in Medicare, you essentially choose between two options. The first option is Medigap, sometimes referred to as a Medicare supplement policy. You keep your original Medicare, Parts A and B, and layer on top of it a Medicare-approved private insurance policy. This policy picks up the costs the original plan doesn't cover. The second is Medicare Advantage. Instead of keeping the original Medicare coverage, you hand your Medicare benefits over to a private insurance company that then administers your coverage. These plans are required to cover everything Original Medicare covers, but they operate differently with their own networks, their own set of rules, and often some additional benefits. Right now, about 54% of Medicare beneficiaries are enrolled in Medicare Advantage, and about 20% have a Medigap policy. The rest either have employer coverage, Medicaid, or no supplemental coverage at all. That shift towards Medicare Advantage has been quite dramatic. Back in 2007, only about 19% of beneficiaries chose Medicare Advantage. Today, it's the majority. We'll talk about why in just a few minutes. So when do you actually have to decide? When you turn 65, you enter into an initial enrollment period. It covers 7 months, the month of your birthday, 3 months prior, and 3 months after. This is when you sign up for Medicare Parts A and B, or simply Part A if you or your spouse will maintain coverage through work. But here's a window that most people don't know about, where they don't realize the significance. And it's probably the most important part of the entire conversation. When you first enroll in Part B, you enter into a 6-month Medigap enrollment window. It's during this period that you have guaranteed issue rights, meaning an insurance company cannot deny you a Medigap policy. There's no underwriting process. They can't charge you higher premiums because of your health history. They can't make you wait for coverage to begin. You're in, no questions asked. Remember that window. We're going to come back to this concept later in the video and why it's so important. Let's talk through the pros and cons, starting with Medigap, also referred to as a Medicare supplement. It's an add-on and helps cover your share of the cost. Things like copays, coinsurance, and deductibles. They also come with their own monthly premium. So what are the advantages? The biggest one is predictability. You pay a monthly premium, and in exchange, your out-of-pocket costs are largely taken care of. No surprise bills after a hospital stay. No wondering what something is going to cost you before you agree to a big procedure. For a lot of people in retirement, that peace of mind is worth a lot. The second advantage is flexibility. Medigap works with any doctor or specialist that accepts Medicare, and that's the vast majority of physicians in the country. There are no networks to navigate, no referrals required, no calls to check whether a provider is in plan before you schedule an appointment. If your doctor takes Medicare, you're covered, and there's no prior authorization. You and your doctor decide your coverage. You're not waiting on an insurance company to approve a treatment before it happens. Depending on where you live and the plan you choose, the monthly premiums can be anywhere between $150 to $220 a month. Medigap also doesn't cover everything. Prescription drugs aren't included, and the extra benefits you often hear advertised, like dental, vision, or hearing services, are not included. So you're trading a higher predictable monthly cost for lower and more predictable out-of-pocket expenses for when you actually use healthcare. For people who value certainty in retirement, this is a compelling trade-off. Now let's talk about Medicare Advantage. When you enroll in Medicare Advantage, you're handing your Medicare benefits over to a private insurance company, which then becomes responsible for administering your coverage. These plans are required to cover everything original Medicare covers, but beyond that, they operate on their own terms. One thing that trips people up: you are still required to enroll in Medicare Parts A and B. Medicare Advantage doesn't bypass this step. What it does is it changes who manages the coverage. Instead of Medicare paying for your services directly, Medicare sends a fixed monthly payment based on the amount of people who enroll, not based on the specific services you use. The private insurer then takes on the responsibility for providing your care within that budget. Medicare Advantage plans come in a few different structures, but by far the two most common are HMOs and PPOs, which you are likely familiar with during your working years. HMOs typically require you to use a specific network of providers and a primary physician that coordinates your care. PPOs give a bit more flexibility to see providers out of network, but typically come with higher costs. Both are quite different from the open access you get with original Medicare and Medigap. So what are the advantages? The first one is cost. Premiums are often zero or very low. For younger, healthy retirees who are not using very much healthcare services, this can save quite a bit. Medicare Advantage also bundles everything into one plan, making it very simple, and it offers some additional services, which can include prescription drugs, dental, vision, and hearing. This is quite attractive for people who don't want to manage multiple policies. And unlike original Medicare, most Medicare Advantage plans come with an out-of-pocket annual maximum, which puts a cap on your exposure if you have a significant health event. Now, the trade-offs. Many plans require a referral before you can see a specialist and prior authorization from the insurance company before a procedure can be approved. That means your doctor must receive approval from the insurance company before they can move forward with a recommended treatment. This can lead to delays and in some cases outright denials. And while the low premium is appealing, your actual costs depend heavily on how much you use your healthcare in a given year. Copays, co-insurance, cost sharing can add up very quickly if something happens. On the prescription drug side, the list of formularies, the approved list of drugs you can use, varies from state to state and can change year to year. If you're on a specific medication, it's important to ensure it's covered before you enroll. So with Medicare Advantage, you're trading off lower upfront costs for less predictability and more out-of-pocket exposure if something significant happens. If you've ever wondered why your mailbox fills up with Medicare Advantage brochures every fall, or why celebrity spokespeople are selling it on television every other commercial, there's a pretty straightforward answer. First, it's promoted by Medicare itself. By routing beneficiaries to private insurance companies, the federal government shifts the financial risk of providing your health care away from Medicare and onto private insurance companies. In theory, this creates more predictable government spending and encourages what's called managed care. The idea that insurers motivated by profits will find ways to coordinate care more efficiently and control costs. So Medicare sends a fixed monthly payment to the insurance company for each person that enrolls. According to MedPAC, the independent body that advises Congress on Medicare, found that in 2024, Medicare sent an extra 22% to these insurance companies than what it would have cost to cover the beneficiary under original Medicare. That gap is generating profits for the insurance company. The financial incentives flow down to the brokers and agents, the people that are helping you make decisions about your healthcare coverage. They're often compensated differently. They tend to receive higher commissions early on and annually for when you sign up for Medicare Advantage plans. None of this means that Medicare Advantage is the wrong choice. In the right situations, it works very well, but it's important to understand why it's marketed so aggressively. So let's come back to the phrase I mentioned in the beginning. I'll try one option and switch later if I need to. Here's the reality. Switching between Medicare Advantage plans is relatively straightforward. You have 2 windows each year to do it. The first one, during the annual enrollment period, runs from October 15th through December 7th. During this window, you can switch from one Medicare Advantage plan to another, you can drop it and return to original Medicare, or make changes to your Part D prescription drug plan. Any changes you make are effective January 1st. The second window is the Medicare Advantage open enrollment period, and it runs from January 1st to March 31st. During this window, you can switch from one Medicare Advantage plan to another. You can drop and go back to the original Medicare. What you cannot do during this window is switch from original Medicare into a Medicare Advantage plan. That's only available during the annual enrollment period. So on paper, yes, you can switch, but here's where it gets a little complicated. It's pretty common for retirees to select a Medicare Advantage plan early in retirement when they're healthy and not using much healthcare. The low premiums make a ton of sense in that scenario. But as people get older and they start to experience a healthcare event, that's typically when they become interested in switching from a Medicare Advantage plan back to a Medigap plan. The costs are starting to rise, maybe the prior authorization, the delays are becoming more frustrating, and the predictability of Medigap starts to look much more appealing. That's exactly when people try to make the switch. But it's often too late. Remember that 6-month Medigap open enrollment period I referred to earlier in the video, the one that starts when you first enroll in Part B? During that period, you had guaranteed issue rights. There was no medical underwriting, no questions about your health history. That's now gone. Outside of that initial window, in most states, insurers can require you to go through a medical underwriting. That means they review your health history. And if you've developed any significant health conditions, that means your premiums could go up or you could be denied coverage. Think about the timing of that. So you start by enrolling in Medicare Advantage. The low or no premiums are quite attractive. You don't plan to use much health care. But then as you age, maybe your health starts to change. You get tired of the prior authorizations. Perhaps some of the providers that were in network leave, and this starts to mount up, and then you want out. You want to switch from Medicare Advantage back to Medigap. That tends to be the moment when switching becomes the hardest. The people who most want to switch are often the ones that cannot. There are some exceptions worth noting. Some states like New York, Connecticut, Massachusetts, Maine offer broader consumer protections and year-round guaranteed issue rights. And if your Medicare Advantage plan is discontinued or you lose coverage due to no fault of your own, you can qualify for a special enrollment period that provides guaranteed issue rights. But in most states, for most people, the window that matters the most is the one you get at the very beginning, or the window that you have before you might otherwise be ready to switch. Medicare isn't a decision you make once and forget about. The decisions you make early in retirement could look very different later in retirement when your health and priorities have shifted. And that's not an argument for one over the other. Both Medigap and Medicare Advantage plans can be the right choice depending on your situation. What matters is that you go into these decisions with a clear understanding of the trade-offs and how much of a challenge it can be to switch to Medigap when you might need it later in retirement. By knowing this, perhaps if you do change, you make that shift a little bit sooner before it's too hard to qualify. If you want to go deeper into how healthcare costs fit into other aspects of your retirement plan, I've linked a few helpful videos. And if you're ready to talk to somebody personally about your situation, I've included a link in the description. Until next time.